Hi, this is Dr. Kingston, and in this video I'll be discussing the Pterygopalatine Ganglion and parasympathetic innervation to the midface. Our objectives here are pretty straightforward. We're going to talk about the origin and preganglionic route of parasympathetic fibers to the Pterygopalatine Ganglion, and then trace their postganglionic pathways hitchhiking with the branches of the maxillary nerve and out to the glands that are innervated by them. Now, these steps hopefully look familiar to you. We covered them almost verbatim in the video on the lacrimal gland. We're going to use this video here both to review and to add in some details that expand these pathways beyond just the lacrimal gland. Once again, though, we're going to start off in the intermediate root of the facial nerve with our preganglionic parasympathetic neuron cell bodies. The axons from these neurons are going to pass into the internal acoustic meatus with the rest of the facial nerve and pass through the geniculate ganglion without synapsing. Instead of following the bulk of the facial nerve out through the stylomastoid foramen and onto the face, the parasympathetic axons are going to branch off and form the greater petrosal nerve, which will travel through the hiatus of the facial canal and into the foramen lacerum. From there, it joins up with the deep petrosal nerve, which, remember, is going to be carrying postganglionic sympathetic axons from the carotid plexus. These have already synapsed in the superior cervical ganglion, and they've ridden on the internal carotid artery to get up onto the head and neck. The deep petrosal nerve is just a group of these fibers that pulls away from the wall of the artery and will eventually serve the midface. Once the greater petrosal joins up with the deep petrosal, they dive into the pterygoid canal and they change their name very appropriately to the nerve of the pterygoid canal. They're going to travel anteriorly through the sphenoid toward the pterygopalatine fossa. The pterygopalatine ganglion is hanging out in the pterygopalatine fossa, and this is where those preganglionic parasympathetics will synapse with their postganglionic partners. The postganglionic parasympathetic neurons will then send out their axons to hitchhike with branches of the maxillary nerve. These are going to carry parasympathetic innervation to the lacrimal gland and to the mucous glands of the nasal cavity, the oral cavity, and parts of the pharynx. Now, we discussed the lacrimal gland in a previous video, but it's worth repeating here that these axons will travel along the zygomatic nerve and the zygomaticotemporal branches of that nerve. And they might either go directly to the lacrimal gland from there, or they might take an extra jump over to the lacrimal branch of the ophthalmic nerve first. To get to the other mucous glands, the parasympathetic axons will follow the maxillary nerve branches that supply those same regions. So for the nasal cavity, they'll follow the nasopalatine and posterior nasal branches. And for the palate, they'll follow the greater and lesser palatine nerves and nasopalatine nerve again. And that is the completed pathway. Now, I know this is kind of a short video, and like I said, it's mostly review, but let's give you an opportunity to do a practice question before continuing. The correct answer here is C. You would find preganglionic parasympathetic and postganglionic sympathetic fibers in the nerve of the pterygoid canal. Remember, the nerve of the pterygoid canal is formed when the greater petrosal nerve, which is carrying preganglionic parasympathetics from the facial nerve, joins up with the deep petrosal nerve, which is carrying postganglionic sympathetics from that carotid plexus. Those have already synapsed in the superior cervical ganglion and ridden up into the head. All right, that brings us to the end. Thank you for watching.